a crack in the knee before your foot even hits the floor. Most people laugh that off as just getting older, but that sound is a joint-absorbing load. The muscles around it should be sharing, because one of those muscles quietly stopped showing up. The usual fix is more squats. 100 a day, push through it. But squats test strength you already have. They don't build strength you're missing. If your glutes are the weak link, loading them into 100 reps of a compound lift is like making a sprained ankle run laps to get stronger. You're not fixing the weak link, you're grinding it down and calling the soreness progress. One exercise, done in under 90 seconds, isolates that exact weak link more directly than any number of squats ever could. No equipment, no deep knee bend. 4 movements get you there. Skip to the end, and you'll miss why the last one works. A squat asks your quads, glutes, hamstrings, and lower back to work together. After years of sitting, the glutes go dormant, so your quads and lower back quietly take over the job. The squat still looks fine from across the room, but the muscle that should fire hardest barely turns on. 100 reps later, your knees ache a little more, and the muscle you actually needed is exactly as weak as when you started. Physical therapists call this gluteal amnesia. The muscle hasn't disappeared. The nerve pathway telling it when to fire has just gone quiet from underuse. Sitting for 10 hours a day hands that job to the chair instead. Then, out of nowhere, you ask that dormant muscle to do its heaviest job yet, 100 squats. It isn't ready, so everything around it absorbs the load instead. Drop a comment. When you climb stairs, is it your knees, your lower back, or just general heaviness in your legs? Subscribe if this is new to you. We build routines like this every week. Movement 4. Standing glute squeeze. Feet hip width apart. Squeeze your glutes together hard, without moving your hips or knees, like holding paper between your cheeks. Hold 3 seconds. Release. 12 reps. This wakes the mind-muscle connection back up before anything harder gets asked of it. Movement 3. Standing hip hinge. Reach. Hands on a chair back. Flat back. Hinge forward at the hips, reaching your chest toward the chair as your hips push back. Squeeze your glutes to return upright. 10 to 12 reps. Feel this in your lower back instead of your glutes? You're rounding your spine, not hinging at the hip. Pull the range back until it's hip only. Movement 2. Single leg hip hinge. Weight on your left leg, hands on the chair. Extend your right leg straight back as your torso hinges forward until your body forms a line from head to heel. Hold 2 seconds. Return. 8 to 10 reps each side. Keep both hips squared to the chair. Don't let them rotate open. This exposes any imbalance a two-legged squat can hide. Movement 1. Single leg glute bridge. Lie on your back, knees bent, feet flat. Extend your right leg straight out, hovering a few inches up. Press through your left heel. Lift your hips into a straight line from shoulders to knee. Squeeze at the top. Hold 2 seconds. Lower with control. 10 reps each side. Keep both hips level. Don't let one tilt higher. This is why it beats 100 squats. A squat gives your body ways to dodge the glutes, borrowing from the quads, the back, the stronger side. The single leg bridge removes every exit. One leg does all the work, with nothing left to lean on. Research comparing hip exercises consistently shows single leg bridging producing some of the highest glute activation of any common movement, often beating both body weight and loaded squats, and it rebuilds the exact pattern your hips use every time you take a step, not just force with both feet planted. 4 movements, 1 system. The squeeze wakes the muscle. The hinge reach fixes your bend. The single leg hinge exposes the weak side. The bridge rebuilds it directly. 100 squats skip almost all of that. Give it 4 weeks. Most people feel steadier on stairs within 2. Tell me in the comments which side gave you more trouble. Share this with someone still grinding through squats that aren't working, and subscribe. Next week, we take this pattern further.